Fibromuscular dysplasia, or FMD. So many questions, so little high quality information out there. So here's FMD Q&A. I've listed 10 common questions about fibromuscular dysplasia, FMD, that I hear all the time. I'm going to try to go through them from the 10th to the 1st in order of how frequently I hear about these questions, and I'll try to offer some answers that you can use in your life. Let's get started with number 10 on our list. So number 10 is aspirin. If I have FMD, do I need to use aspirin? We have data to show that most patients with FMD are prescribed aspirin. Usually, they're prescribed what's called the baby aspirin, aspirin 81 milligrams once a day. The idea behind that is that if a patient with FMD has abnormal blood flow in their arteries, the aspirin might prevent microscopic clots from forming and flying forward, causing harm. Also, some patients with FMD might develop what's called dissections or separation of the layers of the arteries. And if that happens, clot may form. And so in order to prevent those clots, aspirin on board might prevent them. But here's the problem. Aspirin also causes excess bleeding. Now, aspirin is not a dangerous medication, but it does increase bleeding by something. So we don't know what the balance is between the proposed benefits that I mentioned before and this small but real risk of increased bleeding with aspirin. Despite this lack of data, as I said, most of FMD doctors will recommend aspirin, and in the international guidelines, for which I'll give a link on the bottom, probably in the description and maybe in the comments, you will find aspirin as a recommendation. Number 9, do patients with FMD need intervention? Well, the answer is most patients with FMD will never require an intervention. Having said that, a small subset of patients with FMD will require an intervention. So for example, if a patient with FMD has a large aneurysm or an aneurysm that is increasing in size, they may need an intervention to coil, clip, or remove that aneurysm, for instance. A different example, a small subset of patients with FMD will have elevated blood pressure because the kidneys will feel as if there isn't enough blood flow through the kidney arteries. In that small subset of patients, dilating the kidney artery with a balloon may treat the hypertension, the elevated blood pressure, instead of medication or in addition to medication. So those are examples. But again, most patients with FMD will never require an intervention. Number 8, ultrasound showed that I have a narrowing in my artery. What does that mean? Ultrasound measures blood flow through arteries. We can deduce whether an artery is narrowed by analyzing the speed of flow and the way blood flows in an artery. However, the criteria for defining narrowing of an artery, what's also known as stenosis, those criteria have been developed for people with what's called plaque or atherosclerosis, but the flow in patients with fibromuscular dysplasia is different. The artery shape is different. This results in a different flow pattern. The flow velocity may be elevated in different parts of the artery, and analyzing these flow patterns is very different than analyzing them in patients with atherosclerosis. Usually, not always, but usually, when a patient with FMD, fibromuscular dysplasia, sees the ultrasound report from a carotid artery ultrasound or from a kidney artery ultrasound, and that report mentions a significant narrowing, usually that is because the flow velocity is elevated in the distal, further up or further to the side part of the artery. Usually, that does not mean that there's a true narrowing to flow. And interpreting these results, the best way to do it is in tandem with your healthcare provider to truly understand if there's a meaningful narrowing or limitation to flow in you. Number 7, is this pain that I'm feeling serious? Do I need to go to the emergency department? When do I need to go to the emergency department? This is a very common question and obviously very difficult to answer. All of us have pains all the time. Life hurts. But we sort of grow to learn which pains are normal or sort of part of just everyday life. And when a pain is out of the ordinary for us, we understand that we need to seek medical attention. when it comes to fibromuscular dysplasia, especially patients who did have a significant event, so for example, especially in a patient who did have a coronary artery dissection and maybe a heart attack as a result of that, what's called a SCAD, in these patients, it may be difficult to sort of recalibrate the system and teach ourselves again what is normal and what is not. The best advice I give my patients is that you have to sort of learn your body, understand what is normal for you. And I also say it's better to cry wolf than not. So it's better to unfortunately waste some time, maybe be over sort of anxious in the beginning until you sort of recalibrate and understand again what is normal and what is not for you. Number 6, imaging over time, or in other words, do I need to get another CAT scan? Do I need to get another MRI? Is there usefulness in obtaining another ultrasound of my carotid arteries or my kidney arteries? Does that make sense? Well, in the beginning, all patients with FMD, fibromuscular dysplasia, should have scanning from head to pelvis. This means we scan either with a CT or MRI, their head, their neck, their chest, their abdomen, and their pelvis. Once we understand what a particular patient's distribution of disease is, we typically tailor further imaging to that patient's needs. Obviously, if there's a problem, for example, if there's an aneurysm that we need to follow, we'll follow it with repeat imaging. But the more difficult question to answer is, what do we do if there isn't a problem? If we identify FMD and we do not see anything of significance at that time? So what we do know is that in the short term, there isn't any value in repeating such imaging. Nothing will change in the short term. Now, we think that in the medium and long term, nothing changes either. But we don't know that. And I always say that in medicine, we prefer to know over thinking, right? We want to know. So I personally think that it does make sense to repeat imaging, maybe in the medium term or the long term, to make sure nothing new has developed. I am very eagerly anticipating data to come out of the United States Fibromuscular Dysplasia Registry, because once those data come out, I may change my practice. Maybe the data will show that there isn't any change over time. If that's the case, maybe even those repeat images won't be necessary. As I said before, when I spoke about ultrasound, it is difficult to interpret ultrasound. And so obtaining an ultrasound should be done only if you feel that it, or your healthcare provider feels that it will add useful information. Number 5, should my family be tested? I was found to have FMD. Should my family be tested? Well, FMD is not a genetic condition per se. What does that mean? Obviously, everything about us has something to do with our genes. You may have read that there have been genes that have, or gene locations that have been found to be associated with FMD. But we do not yet have a test to kind of definitively identify whether a person has FMD through genetic testing. Also, if a person doesn't have symptoms, if a young person in your family doesn't have any symptoms, even if we do find FMD, it won't necessarily change anything that we will tell them to do throughout their lifetime. For that reason, we typically recommend imaging or testing for people who have symptoms. Otherwise, we typically do not recommend sort of broad screening of family members if you have been found to have FMD. Number 4, events over time. This is a big one. Patients who have had a negative event associated with their FMD, for example, like I said before, spontaneous coronary artery dissection or a heart attack because of a heart artery problem. Perhaps they had an aneurysm of significance or dissection elsewhere. Obviously, these patients are very concerned that this may happen to them again. We have data that show us that the majority of patients will not have another event. Obviously, first of all, you are treated now. Typically, a patient who had an event will be treated with medications and will be followed after this event. Also, most patients will receive recommendations about lifestyle, which will modify their risk. And overall, we know that most patients will not have another event. Unfortunately, we do not have tools to help us identify which patient will have an event and who will not. So close monitoring and close attention to your own body makes sense. Now, what about a patient who was incidentally found to have FMD? A patient who has never had an event, but imaging showed that they have FMD in some of their arteries. We know that the vast majority of these patients will never have any negative event associated with their FMD. So I hope that is reassuring. We're now down to the big three. Number three, where can I find reliable information about fibromuscular dysplasia? Super important in my opinion. If you just Google FMD or fibromuscular dysplasia, if you just go into sort of various chat groups, etc., without discriminating, you may stumble upon chat groups that are not run by medical professionals and that may have some disinformation in them, or people highlighting negative events over sort of the more common natural history, or the more common way that FMD behaves. For that reason, I really highly recommend that you start your journey at the United States FMD Registry website, and also at the FMD Association at the fmdsa.org website. That would be a very good place to find reliable resources. Number two, is there anything I can do to live a healthier life with fibromuscular dysplasia? So the answer is difficult. There are some things we know and some things we don't. First of all, we do know that general recommendations, as we would recommend to anybody about healthy diet, healthy lifestyle, etc., those pertain to people with FMD as well. Now, if a person had a negative event, for example, they had a carotid artery dissection, or any other such negative event, such people likely need to modify their physical activity, and I'll talk about that when I get to number one. But what about people in whom it was found incidentally? In those people, we have less data, and the formal recommendations are to use common sense. Other than that, it is very important specifically to pay attention to hypertension. And here's at least the way I see it. If our blood pressure is elevated beyond the usual negative effects that it has on our health, in people with FMD, that excess pressure from the inside of the arteries, we'd like to avoid that, because if we assume that the arteries have some delicate component to them, we'd like to avoid excess pressure from the inside. So paying specific attention to elevated blood pressure makes a lot of sense. We're down to the big number one, the question that I hear most commonly, and that is, can I do everything I want, or do I need to limit my physical activity when I have fibromuscular dysplasia? If you go to the international guidelines for fibromuscular dysplasia, you will see that there's a paragraph about that, where we basically say that while there may be risk for negative artery events such as artery dissection, we should exercise with common sense. Now, what does that mean? I've seen patients receive various recommendations, anything from avoid lifting X amount of pounds through avoid this activity or the other. In many instances, I really don't know that that is based on data. Here's a few things we do know. We do know that some chiropractic manipulations, for example, manipulation of the neck, may injure the neck arteries, so that would be wise to avoid. We do know that activities that throw the body around, such as roller coasters, bungee jumping, parachuting, maybe martial arts, those are best to be avoided. And then when it comes to weightlifting, we know that if we strain against weight, that's called Valsalva. If we strain against weight, then that may increase the pressure internally, elevate our blood pressure acutely, and that may result in damage if we have delicate arteries. The typical recommendation I give is that every person is different, right? One person is bigger than the other, one person is stronger than the other. So don't look at a specific number of pounds, just remain in that level of activity that is comfortable for you, where you can avoid straining. So those were my big 10 questions and answers about fibromuscular dysplasia. I'd love to hear more questions for you. Please do write them in the comments section. And if I missed anything, I'd love to reply, maybe add another video with more questions that may be interesting for you all. If you find the video useful, like, subscribe, share the video with your friends, and I'll see you next time.